Okay, so today we're going to be talking about how good is Puerto Rico's medical system or health system. So, we're I have a few questions that I got from Instagram from you guys and from YouTube community post. Like always, I ask a question so you guys can let me know what do you want to know, because I don't know everything. So I have an idea of what you guys want, but if you tell me, then it's clear. So I have a few questions. Hopefully, I don't go in a tangent here. I'm gonna try to focus on each question, and then if I want to add anything at the end, if I want to read some stuff from here, I'll read stuff from here. Um, but it's gonna be how good is Puerto Rico's healthcare system here? So let's get started. So your questions, and I'm gonna answer as best as I can, because obviously I don't have the answers to everything. I can only go by my experience, what I hear, what people tell me, what I read, things like that. So, my answer is not the only answer. My answer is not the correct answer or the incorrect answer. So let's get started with how veterans are taken care of in Puerto Rico. So I guess there are a few veterans here on my channel. So I'm not a veteran and I barely know any veterans, but I did ask somebody that has been a veteran for a very long time and has retired a very long time. And he gets taken care of in the west side of Puerto Rico. And so, from his point of view, which is the father of someone I know, is it might be better in the VA. It might be better than the regular hospitals or regular doctors. So he didn't say it's like it's amazing, He says like, you gotta wait for your appointments, wait for doctors. So it might be a little bit better than for the regular folks like me. So that's all I got on the veterans topic, because obviously I don't know much on that topic. So I don't want to lie. I don't want to make stuff up. So that's all I got for you. It's okay. Some people might say it's great because there's always going to be different experiences. Some people might say it sucks, but from what I've heard, it's just a little bit better than for the regular people. Okay, next one. How long is the wait for a specialist appointment? So it depends what kind of specialist, because I have had experience where somebody needed a dermatologist, not me per se, uh, and it was about 6 months wait. So imagine you have an allergy or something on your skin, and you need to wait 6 months to be looked at. So that's crazy. I know. I think when I lived in New York, it wasn't like that. I made an appointment with a dermatologist. Boom, I was there like in a week or 2 weeks. So it's a little bit different here with the specialist. The specialist is where all the negativity is at least for me and from what I've heard. Because uh, to get back to the question, how long is the wait? So it could be, let's say, 6 months for some doctors, some specialists. It could be 1 month. My experience has been maybe wait a month, 3 weeks, 3 weeks, a month and a half for a specialist. So, I mean, you gotta wait. You definitely have to wait when it comes to a specialist. So the answer is it depends, okay, which specialist, but you definitely have to wait. Okay, next one. How easy or difficult it is to find a primary care doctor. And there's more to it, but I'll get to that. Okay, so how easy or how difficult it is to find a primary care doctor. So I didn't have any troubles. I got a doctor, which is a female, and I'm still with her for 4 years already. So she's been great. I found her easily. When I make appointments with my primary doctor, it takes about maybe a week to see me, sometimes less. Sometimes I'd be like, hey, do you have a spa? They're like, yes. Come in 2 to 3 days. Like let's say Friday, come Friday at 3. And so I've been taken care of in a matter of days. So that has not been an issue for me when it comes to the primary doctor. Um, let's see, what else? How difficult or hard? Easy. I gotta keep reading it to see if something else comes to mind. How easy or how difficult? Um, Also, when you have insurance, you can look online with your insurance. So let's say you have triple S, which is triple S. You can find the list of doctors within your town. So you can look for one in Mayagüez, you could look for in San Juan, you could look for anywhere you're at. There's a list of, I believe, per town, and you could just find one and find maybe three and start calling and ask whatever questions you want. Ask how long you have to wait for your first appointment, because usually when it's the first time you're visiting somebody, it might take longer or they might not take you. So for some specialists, like the dermatologists, we go back to that. Um, they were I called for Sergio not too long ago, and they were like, we're not taking new patients, even though they saw him 2 years ago. He's new already again. So they're like, no, sorry, we're not taking new patients. And the next appointment will be June or July. And this was months back. So imagine all that wait. Um, so it can be difficult at times like that. But I would say, just find one with your insurance if you have insurance, and get to that list where it says which doctors. Pick three, start calling, ask your questions, and then pick one. If you don't like it, change it. That's what I can say. And then with that same question, same person, um, urgent cares available. So here they don't really call them urgent cares in Spanish. I believe they're like clínicas, maybe clinics. I'm not quite sure, because like in New York, I used to see where it says urgent care everywhere. In Manhattan, I remember where I used to work. It's like urgent cares in every corner. But here, it's like they don't say urgent care in the outside. Maybe in some areas, like maybe like Condado or like Santurce, where like there are a lot of like people from the states, but uh, there are available, especially in the metro area. The metro area, you're gonna find more of these things. Um, so I think they're called like clinics. So some of the names are. I remember I made an appointment for Sergio called Salus. Salus. Instead of Salud, is Salus. Salus, that's like an urgent care where you have a problem, you have a fever, whatever. You go, they take care of you. They give you a prescription, and you're good. Um, I went to one time when I hit my head really bad. I was like bleeding, and I went to. I didn't go right away. I waited a few days because I started getting worried about the choquetazo I had in my head. I had a big bump and stuff, and I still have the mark here. And I went to Metro Pavia Clinic, which is in Carolina. And the wait was like, ugh, I was there for a few hours, maybe two, three, four. I don't remember because it was more than a year ago. But I was there for a few hours. So yeah, that was Metro Pavia. Sorry, Pavia. I always say Pavia. It's Pavia Clinic and Salus. Those are the two that I know by name, but there are more. Okay, so I'm done with that question. Wait in the emergency rooms and cleanliness. So the emergency room, in my experience, I have never stayed at a hospital here in Puerto Rico. Even when I lived here, I was never like any surgery. I was never like sick to the point where I'm at a hospital. And right now, neither. So I have never been a patient myself here. I've only been to the emergency room once in my life, and it was in New York. And it was a surgery and everything, appendix. This is my only surgery, my only time at the hospital. I was there 3 to 4 days, and this is my only time, only experience. So here in Puerto Rico, I only have experience with my dad because my dad is at the hospital all the time. Today they called me, and I'm a little stressed out right now because they called me that he's going back to the hospital because he has something else now. So um, yeah, so the my experience with that and my sister, I even asked her to get her input and kind of like hear her out to see if it's like the same as my thoughts. And the emergency room, I believe it was clean. At least the one in Mayagüez I've been to, and it was clean. You see people cleaning all the time, and so the cleanliness is pretty good, at least in my experience. Obviously, there might be some matapuercos, as they call it, hospitals, but I haven't been to one of those. And the wait in the emergency room is pretty bad, at least in Mayagüez, since it's my only experience. In Mayagüez, I my dad has waited 3 to 4 days in the emergency room to get a room upstairs because they don't have space, which I've mentioned this in another video that I did. My voice is low. Geesh, I just read that. My voice is too low, hard to hear. Oh boy, hold on. Maybe if I take out the microphone. Let's see, guys. Hold on. See if it's better now. I'm gonna make it a little closer to me. See if it's better. Is it better? Let me know so we can continue. Let me know if it's better. Is it better? Testing? Yes? Okay. I hope I didn't waste time here talking and I didn't read it until now. Better. Okay. I had this on the microphone, which is for wind, but usually that's no problem. Let me see how I'm going to put this microphone here now. Maybe I'll hold it. So I don't move my hand so much. Okay, so the wait in the emergency room has been 3 to 4 days. Let me know if it's good, because if not, I'll disconnect the microphone. The other time I didn't use the microphone. I figured I use it now. 3 to 4 days, a week, basically in the hallways of the emergency room, waiting for a room because there are not enough rooms to have my dad have his own room. So that's one of the downsides here. That waiting part in the emergency room. Thank you, Hector. Okay, so it's good right now. So can you imagine going to the emergency room and having to be in the middle of everyone? Sometimes they have those little dividers with curtains in the emergency room, which is okay because it feels like a room. But sometimes my dad is like in the hallway, like where they come in the ambulance. You see it sometimes filled with people on this side of the hallway and on this side of the hallway and on that side of the hallway. And it's like a bunch of people in just waiting for a room. And yeah, it could take up to like a week. And so it's horrible. And years ago, which I mentioned this in another video, that my dad had a surgery, and they brought him here, I think to Rio Piedras from Cabo Rojo, and he was more than a week or a week in the emergency lane on the hallway with his broken, I think it was the thigh, like the femur, el femur. Um, he had it broken. They broke his bones. He literally has tornillos. He literally has screws, and he didn't have it back then when something hit him, and they left him a week in the emergency room with his um, leg broken because there was no rooms to because even if there's a doctor, a surgeon to operate him, where are they going to put him after? So they have to have a room available in order to help you. So that was horrible. I still remember it to this day, and I was pretty young. I was like half my age right now. Um, so, by the way, I want to interrupt here. The comments you guys leave here, if I can't read them because I'm trying to concentrate to answer, I, I can't see them later. So I experienced that in the first live, and so when I put this video up to so then everybody can see it after, um, they I couldn't read them. So I was like, so if you write something here when I post the video after a few minutes when we hang up here, then leave your comments over there so I can read them because I cannot read them here because I'm busy. I'm busy here. So sometimes I look, but then I get distracted. So yeah, so do me the favor and comment when we're done here. Go to the video when it's up, this video, and comment over there. Okay, so we're done with the emergency room. Quality of service. Hold on. See, I get distracted. Quality of the service, how organized from picking up the phone or online. Yeah, that online thing doesn't really exist here with doctors. They're a little bit behind on that. Make an appointment. So from the phone, making an appointment to receiving the service. That's the question. And well, like I like I say, it depends because there are some offices that you call, nobody picks up, and you call the next day, nobody picks up. And it's like you don't even know at what time they open, they close because you call, they don't pick up. You think they're closed. Are they on vacation? Because doctors here take vacations, especially like holidays, summers. They're gone. They're gone for like a week, 2 weeks, sometimes a month, and it's like that doctor's gone. And if something happens to you, you're screwed. You got to go to the emergency room or find somebody else. Um, so they take vacations here and they're gone for a long time, usually. Um, so sometimes when you call places, they don't pick up. And some places are very reliable when you call and they pick up and they help you. They help you with kindness, nicely. They help you. And then some people, they do pick up the phone also and then they talk to you like estrujado, like they just want to rush and hurry up and like you could hear that they're bothered. But that happens everywhere, everywhere that happens. So, um, making the appointment, I mean, it's pretty easy. You just say, you just ask them like, when is the what is it called, the earliest appointment that they have, and if it's not a specialist, you should be fine. And if it's a specialist, then you're gonna wait. Um, to receiving the service, well, receiving the service, I guess is okay, but mainly you're gonna wait a lot. Mostly you make an appointment, and most doctors are by arrival. So even if you have an appointment, it's whoever gets there first. Does that make sense? No, but that's the way it is. It's like, and they usually tell you on the phone, it's by appointment. Okay, so 8 o'clock, but it's by arrival. Whatever you say that, however you say that in English, because they say it in Spanish. Por orden de llegada. Everything is por orden de llegada. But you got to make an appointment, una cita. So it's like it makes no sense. Some places you don't need to make an appointment, but most, in my experience, most places you need to make an appointment here in the metro area. I don't know, in the west side or anywhere else, but usually you need to make an appointment. And receiving the service, well, some, like everything, some treat you well, some don't. They give you minimal information. They don't educate you too much. I mean, there are good doctors and there are not so good doctors. There are terrible, disorganized, that you, just by looking at the office, you can tell what kind of doctor it is. Um, you can see that the stacks of files, and they're like all dusty from 1998 there, and so you can tell. I like to pass by places first before determining and see the place first. That's what I can recommend. Next one. Do they accept TRICARE? So apparently, TRICARE is like an Air Force's kind of insurance for people, maybe veterans or something like that. I'm not sure. But that's the question, TRICARE. So if you're interested in that TRICARE thing, um, I believe they do accept it because I know nothing about TRICARE, but I looked it up, and because I'm always curious when somebody asks me something, I kind of get curious and I want to find the answer. Um, but I believe so. It said yes. Wherever I found it, it said yes. So I would say I believe so. Okay. The most asked question, you know what it was? It's the following one. The most asked question was, what's the average cost for health insurance? So the average cost, I would say it's about 200 to 350 a month. It's like a little car payment. So having insurance is a car payment. um, it's if you're getting insurance, obviously there are some that are like on the cheaper side. You can pick one that's like medium. There are ones that you can pick that are like luxurious. So it depends which one you pick. So that's why it can go from like 200. I know like a medium one can cost like 280, and then the more expensive ones like 350. I'm assuming it's the copay has to do with it. So like the more copay or the less copay you want to pay, the price is going to change. But if you are, in the low resources, income wise, you can apply for Medicaid and pick an insurance with Medicaid, and they'll approve it. And you can get like, let's say, triple S, triple S, with it's called here Reforma, the Medicaid card here. It's called Reforma. Like if they're asking you on the phone which plan you have, you say Reforma, so they know it's the government one, the one that's free for people. So obviously you can make a lot of money, and it's free, and they'll approve you, and you pay almost barely any copay. Everything is like 000. Maybe you pay something somewhere. Oh, and by the way, their birth control here is not covered under insurance. At least my insurance doesn't cover it. So you have to take care of it out of pocket. I used to use the patches that you change once a week, and when I came from New York, I was like, "Hey, I want the patches," and it's like, "Yes, the insurance doesn't cover it, and it's $200 a month for these patches. It's four patches, no, three patches, because it's three, and then you get your period. So it's three patches, and it's like $200. It must be more now because 4 or 5 years have passed by. So it's not covered under my insurance, so I have to pay out of pocket. So then I changed to pills, because pills then I pay way less. Yeah, so that was the most asked question, which is the cost. ¿De qué parte de Puerto Rico eres? Yo, I live in Carolina, but I'm naturally from Cabo Rojo, and I'm a New Yorican. um, so yeah, option Medicare, Medicare. Yeah, Medicaid, Medicaid. I always confuse Medicare and Medicaid. Um, or pay your own private insurance. Next one. Hold on. Do I have? Okay. Uh, do you feel confident about diagnosis and treatment in both doctors and hospitals in Puerto Rico? I I think they are just as educated as anywhere else. I don't think they're incompetent. Um, there's going to be incompetent doctors everywhere where you go, and there's going to be smarty pants wherever you go. Um, I kind of feel confident. I wouldn't say super confident, but I feel confident that they're just about the same as anywhere else. So I don't really doubt it much. Um, Again, the volume. My sister told me, get closer. Get closer to what? The microphone? Don't tell me it's still low. Hold on. I don't know. Okay. I think um, I'm confident. They seem competent, so I would say yes. And one experience I had was, um, you know what? I'm gonna remove the microphone. I might just remove it, but I'm afraid something could go wrong. Maybe I'm covering it. I don't think so. I have another one here. Maybe it's the microphone. Um, I have so many, so many. Hold on, guys. Changing. Let's try. I have so many microphones, but I don't know which one is gonna work. So that one was a pretty new one. So I went to my old one here. How is it now? Let me know while I wait here. Better? Yes? So it's that microphone, unless it wasn't plugged right. I don't know. Some people are saying the audio is fine, and some people are saying it's not. Okay, sorry guys. The worst thing you can do is have bad audio, so I don't want to do that. Okay, good now. Okay, so what I was gonna say is that my mom had cancer. She passed away long ago, but and she was being treated in the west side of Puerto Rico, and she had a doctor which looked very messy. My sister, she's there. if my sister's there here, she knows that oncologo is the cancer doctor, I believe that's what it is in Spanish. And it was in Mayagüez, and he had such a messy office, like the stacks of files and like all over behind him, all over. Everything was like disturbingly disorganized and just clutter, and it looked horrible, that office. And so we were doubting how good he was or not good. And so what I did is that I knew somebody from, you know, that cancer is the best cancer, I guess, hospital in Manhattan, New York, is Sloan Kettering Memorial, I think it's called Sloan Kettering. Do you guys know that? Sloan Kettering. It's a cancer hospital in Manhattan. I think it's Midtown or something like that. I used to pass by it all the time, and so we knew somebody that worked there, and he was a cancer researcher or something like that. And so we gave him all the documents from the doctor, from my mother, you know, her files, all her placas, x-rays, because she had like metastases, I think it is, where you know, it's spread throughout a bunch of places in her body. And so she had all the files, and I gave them to this guy, and this guy took it to Sloan Kettering, where he works, gave it to one of the best doctors at Sloan Kettering to see if there were what do you call it? If they were giving her the proper treatment for what she had, and if they were doing the right thing here in Puerto Rico. Metastasis, yeah, I think that's what I said. And they actually, I was shocked. I was surprised. They said yes, that everything that they were doing here in Puerto Rico for her cancer was exactly how they would treat it over there. Which, I mean, if you think about it, the United States is also corrupt in every way. So it doesn't make me that ease. But that at that time, I was like, okay, so they're doing what is need to be done. And that's what they would do. The treatment she was getting, it was the proper one. So So I felt like, okay, they're not that bad here, right? Okay. This one's in Spanish. ¿Cuánto tiempo duraste sin seguro médico al mudarte a Puerto Rico? So how long I took to get insurance, health insurance, when I moved to Puerto Rico. So I was without insurance for like, I would say I moved here in October. I think I had insurance already by December, probably. November or December. So I was like 1 month or two at most without insurance. And then I got insurance. So it's not bad. Next. Another one in Spanish. El pago por visita sin plan médico. So this is like how much it is for visiting a doctor without health insurance. I don't know because I have never gone to an appointment without health insurance. So I don't know. And I think that prices are different when they charge you with insurance and without insurance. I don't know. This is what I think. I don't have evidence to this, but because I have papers here where the breakdown of like what they charge me for my visits, and for instance, the dentist is like all the things that they did to me and cleaning and all that stuff came out to 144, which sounds very little. $144, I think it's not that bad for a dentist. So I don't know if they charge that if you come without insurance. No clue. And I have another one here. It's oh look, when I went to in 2023, I went to Metro Pavia Clinic, which I told you about earlier, that they are that urgent care, and that urgent care charged $65, but to my insurance, not to me. So it says $65 for the urgent care. And gynecologist, it says, and a lab, it's like 500, less than $500. That one is a little bit more pricey. So I don't know if they would charge me that $500 for a gynecologist and maybe like a pap smear or something like that. Like one of those gynecologist yearly testing that they do. So I don't know. I'm not much help. I don't have the answers to everything. I wish I did, but you know, I can only go by my experience. My copays are like zero, and some copays can be $10. Some copays, like let's say emergency room, can be the copay $25, $50. Specialists can be zero, maybe 10, maybe 20. Those are the copays I've seen. So to talk about the title of this video, right, which is how good is the health system here in Puerto Rico? How good is the health system here in Puerto Rico? Well, that is debatable because everybody says it's bad. Everybody says is horrible, it's broken. But as you live it day by day, you know, you might feel different. Because sometimes I'd be like, oh, okay, it's not bad. Look, this went smooth. Oh, this was cool. Oh, they treated me well. Oh, this went well. And then some days it's like, oh, I hate this. Look at this. Like, they didn't help me. Like, look at that. Look at this. Like, they made me do, like, the runaround. I went here. Then they told me, oh, you didn't have this. So they made me come back. And so it's a lot of coming and going. And they make you go and come and go and come and go all over again. It happened to me already, where you go and it's like you're missing something, or I didn't know, nobody told me I needed that, so it's like, how am I supposed to know? So you got to walk around with like a file, like a file cabinet with you, so you can have everything just in case that they ask you for something, or like if you need a referral, or if you need this, or it's so annoying. But I think it's Is it horrible? I wouldn't say it's a nightmare. At least for now. At least for now. I still haven't like, used every doctor and every specialist and stuff. But I'm getting there because I'm getting old, and right now I'm like, oh, I'm dying to stand up because of my back. But I don't think it's horrible or a nightmare, but it's not great either. It's not great. But I don't think in the States is great either. It's just like less waiting maybe. um, you might get better services somehow, but here I don't think there's much difference. Sometimes. Um, yeah, the most complaints are the specialists. Yes, somebody wrote there. Um, so yeah, sometimes they don't explain well, and it's like you're lost. I have a few notes here that so I could remember. Receptionist is not so nice sometimes, and it's like you don't even dare to ask her something because you feel like she's gonna bite off your finger, and so it's it's not it's not great. Um, and some doctors might be stuck in their old ways, like in the traditional way. They're still like writing their referidos or like writing everything instead of, using technology. Like my gynecologist, she could just send to the pharmacy my my RX, and she just sends it. Boom! I just gotta pick it up. And then some of them are like still giving you the paper where you gotta go and then wait for it. You know what I mean? So some are stuck in their old-fashioned ways. But there are a lot of young doctors. Um, there are a lot of young doctors. I'm like, wow, she's like super younger than me, and she's taking care of me. Like my dentist looks super young. She looks like she could be my daughter. Love my T-shirt. Thank you. It's my T-shirt. I'm not selling them yet. Not selling them yet. I'm not sure if I will, but I still have a few hats. If you're interested with this logo, you can email me or write to me if you're interested in the hat. Okay, so one thing is like the ER. Uh, you feel lost when you're in the ER. With my father, um, you're waiting, and it's like every time somebody comes, my sister says it's like playing hot potato, papa caliente, because it's like nobody wants to do their job in the ER, so they're like, no, no, the next one, or like the next enfermera, the next one. And it happened with changing something on my dad. Nobody wanted to do it, so the next one. It was like hours and hours passed by, and they still hadn't changed them. um, and also you ask them something like, okay, I came to see my dad, how is he doing? They don't know anything. They can't say anything. I don't know if they can't say, they don't know, I don't know, but they don't tell me anything. They don't tell my sister anything. So we're always lost. If somebody asks me, how's your dad doing? I don't know, because apparently nobody knows. So every time I go see him, I don't know what's going on. So then, for instance, my sister that's mostly there, she wants to know what's going on, and it's like there's no doctor to explain to her. And every time she goes, there's no doctor. The doctor passes by, maybe, I don't know if they do once a day or once a week or once every few days. I don't know, but um, every time she goes, she can't find a doctor. She can't find answers. Um, so it's like you gotta wait to, bump into the doctor that is helping him, to then they be like, oh yeah, he has this, we're doing that, we're treating this. And then finally, because you bumped into the doctor finally. So you don't know when it's that gonna happen, because it's not at a certain time. It's not like you could say, oh yeah, Monday at 3 you're gonna talk to the doctor. Like, no, you just gotta find them or bump into them, basically. So that has been part of the problem with not knowing what's going on with my dad or whatever patient it is, because you never see the doctor. And I understand why. They're going from hospital, sometimes hospital to hospital. Sometimes they go, they have their own practices. They're all over the place. I understand that, but it's like, but then we're lost too. So let's see, and the staff in the ER. I mean, I understand their job is hard, and it's not easy at all to deal with the people there, the scenes there, the ambience there. Everything is hard there. I totally get it. But they don't seem kind. Um, Maybe one or two people they're nice, and then the others are like ugh, and they don't know nothing. So they don't know nothing, and then they don't even want to talk to you. You can tell that they pass by you and please don't ask me nothing, please don't ask me anything. You could tell it in their face. um yeah, you can watch the replay. This video will be up. Well, once we're done, I'll set it up and you can watch it from the beginning. So don't worry about it if you came late. So yeah, I think that's it. Like I said, if you commented here something important or saying hi or whatever it is, comment it on the video when I post it, because this, if you wrote to me something and I didn't read it, live, it's gone. Like I can't get to it, I can't see it. So make sure you write to me in the comments over there. And if you are new here, my last live brought me a few people that are new. So if you're new here, welcome. And I do content all about Puerto Rico, real things, places, information, educational, vlogs, renovations, you name it, I do it. I'm always busy. And you can subscribe. So I hope you enjoyed it. I don't know if I want to get some questions here. Let's see. If anybody want to ask me something maybe that I can answer. Sounds like your father has been kidnapped. Very strange. Why you don't find another place? Well, because it's not that easy. It's not that easy. He doesn't have many people. He only has my sister close to him. And if I bring him over here, then he'll only have me. So it's always going to be divided. And he's in a home. So we don't have many choices as to where he's going to go, because they take him from the home in the ambulance to the nearest hospital. So we don't have, and doesn't mean that if you change hospital, it's going to be better. It could be worse. So that's not always the solution here. It's not that easy. Things are, I've noticed that people think everything is easy when you just do this. It's not that easy. It's not that easy. Yeah, any questions? I think I answered a lot. Hello from Queens. Many blessings. How long have I been here? LGBT. Wow, I've been almost an hour. I gotta go. I need to shower and eat. Well, I hope you enjoyed it. I'll try to continue to do lives and improve the quality. Now I know that microphone didn't work. This time I got light because the other time was too dark. So I'm trying here. But I'll see you in my next video.